Afternoon, everyone. My name's Adrian Bauman. I'm from Sydney University, but I'm actually speaking to you from Denmark this afternoon, your time. Welcome to this Prevention Centre webinar on the Australian Systems Approach to Physical Activity, a project we've been involved in for the past 3 years. I'd like to introduce my colleagues, Bill Bellew, Tracy Now, and Ben Smith, who will be speaking to you today. And we have a special guest also beaming in from Europe who's going to be carrying this project forward into its future. I'd like to just acknowledge that most of you are on Aboriginal and Torres Strait Islander lands, and I'd like to acknowledge their custodianship of the land in which we work, live, and meet. Just a couple of housekeeping matters. We're going to be using Slido for polls. We're going to be polling your opinions and getting some views, and that's just appeared on the screen, the link to Slido. And also we'll be using the Q&A box for questions. Oh, for Slido, use the hashtag activity to get into Slido. You don't need to download the program. You can just log into the web link and then use hashtag activity. Also, please use the question and answer box for questions, and Ben Smith will moderate those questions at the end. I'll try and answer some of them in the Q&A box during the process. Without further ado, I'll hand over to Tracy Now and Bill Bellew, who are going to take you through what we've been doing for the last few years from a systems perspective.
I'm going to give you a moment to just complete your questions in the Slido. And can I suggest that you leave that open during the course of the webinar, because we'll be having a few other questions for you in a moment. Okay, I'm going to speak to you about an integrative systems-based approach to physical activity. First slide. I think Karen's going to show us the results. Are you, Karen? So for each question, you'll see results almost immediately within 1 minute, and that's about the duration that you'll get to complete these polls as we run them. Okay. What does an integrated approach comprise when we're thinking about systems-based approaches to physical activity? I'll answer this question by doing a literally whistle-stop tour. We'll look at the individual level, the organizational level, or settings and strategies level. Then we look at the high leverage points across the system. It doesn't matter that I'm going to do a whistle-stop approach. Next slide. But it doesn't matter that I'm going to be very bright and breezy and fast here, because everything that you see here will be available online and you can explore this systems map yourself. More about that later. First, we have a set of 4 core influences on physical activity. You'll note the word individual is prominent, and we're at the individual level, whether it's psychology, individual responses to social environment, individual demographics, or physiology. These are the core influences. Next slide. Here we add a pale green set of elements. The 8 key interventions by strategy, like mass media, or by setting, like education. These correspond to the 8 best investments for physical activity identified by ASAPa. So we have moved from the individual level to the organizational and strategic setting level. Next slide. Now we add 10 dark green elements. These are what we term the system level enablers or leverage points. Interventions by setting occur at the second tier, the light green, while system level high leverage enablers live here. Our systems mapping software, next slide, allows us to look at subsets of the system and the linkages that apply. So here I've done the cross-sectional slice, looking at a focus on legislation, regulation, public policy. You notice the arrows go back and forth. We've moved on to planning, physical environment, urban design. Here we look at multi-sectoral strategic partnerships. And here at whole of system surveillance. Now I appreciate you won't have had time to read those, but as I've said, I'm just giving you an idea as to what's available so you can explore these online yourself. Note that a surveillance mechanism that looks not only at the behavior of individuals and populations on the far right whole of system, but it also looks at the behavior of organizations and other elements in the system, such as legislation, financing, and leadership. So what does it all look like? Well, here we see a busy integrated systems map. It spans core influences, strategic level and system enablers, and leverage points. And as noted, you can visit this map online to explore subsystem level. And I'll conclude by noting the new publication, which provides the links you need to our tools, resources, and explanatory videos. These are also available on the Prevention Partnership Centre website. I'll conclude there with this rapid whistle-stop tour and hand you over to Tracy now.
Thanks very much, Bill. Okay, well, I suppose you might have gathered from our project name ASAPa that we have a fairly healthy appreciation for acronyms. So I thought, you know, it's a Thursday afternoon in Australia at least. So I thought we might just start off with a bit of a fun pop quiz just to see how well you know some of these acronyms. So I'll just redirect you back to Slido. If you can go back into Slido, we'll start off with the first question, which is, what is GAA3? Is it A, an expression for being triply exasperated? B, go Aussie Aussie, repeated 3 times? C, a guide for policymakers on systems approaches? Or D, is it the Gaelic Athletic Association, the 3rd chapter? Please cast your votes. And I think quite a number of you have probably heard of GAA3, which is great. Another 3 think it's go Aussie Aussie repeated 3 times, but it is actually a guide for policymakers on systems approaches. Okay, let's move on to the next question. What is ramparts? Is it A, a castle wall, B, a typo for arm parts, C, an art collective for street art on public ramps, or is it D, a conceptual framework for law and physical activity? Okay, well, it looks like the majority of you believe that it's D, and that would be the correct answer. I think I've made this too easy. Let's look at the third question. What is a pass? Is it A, pretty annoying session on systems, B, not a fail, C, physical activity surveillance system, or D, something I want to say in response to this question? Please cast your votes. And yes, overwhelming number of you believe that it's a physical activity surveillance system, and you would be correct. So thank you very much for playing along with me. I hope that it's piqued your curiosity to find out a little bit more about what these acronyms are all about. So I'm just going to share my slides again. Oh, geez, it's just not resumed from where we left off. Okay, well, I'm pleased to be here presenting the findings from our work from the last 3 to 4 years alongside my colleagues and team members, Adrian Bauman, Bill Smith and Ben Smith, Bill Belly and Ben Smith. I'd also like to acknowledge some other important contributors who are listed on this slide here, as well as our funding partner and the funding partners of the Prevention Centre who have enabled this work to occur. So why a systems approach for physical activity? Well, currently more than 1 in 2 adults are not active enough for good health. And unfortunately, that's a situation that hasn't changed very much over the last 2 decades and more. In 2018, the World Health Organization issued the Global Action Plan on Physical Activity, otherwise known as GAPA. And it called on nations to prioritise this as an issue and to reduce population physical inactivity by 15% by 2030. In that document, the WHO recommend using a systems approach, one that addresses these 4 strategic areas that you can see in the coloured hexagons. So essentially generating more positive social norms and attitudes around physical activity, as well as improving the quality and the availability of places and spaces and programs and opportunities where people can be active. And finally, it notes the importance of strengthening active systems. So those systems enablers that we saw in Bill's conceptual systems map, all those factors that were identified in the dark green in the outer layer of that map. So things like governance and leadership, financing and resourcing. So as researchers, we also play a role in the physical activity system. So I thought what I'd do is I'd use the systems map that Bill presented earlier to show you where in the system we directed our activities. And this is a bird's eye view that shows you at a high level where we focused our efforts. And I'll go through each of these in more detail as we go along. But first of all, let's start with mapping the physical activity landscape. So here we were looking to see what sectors are active in physical activity promotion and how are they going about this in terms of their programs and their policies. We were also interested in understanding to some extent how policies are addressing some of those systems level enablers. So things like multi-sectoral strategic partnerships as well as governance and accountability. To start with, we held 2 national meetings, bringing together over 30 policymakers from a range of different sectors, who we engaged with via the National Physical Activity Network, otherwise known as NPAN, which is an informal network of policymakers who are engaged in physical activity promotion. And some of you might be here with us today. So at these meetings, we invited these representatives to share some information about the policies and the programs that they had to contribute towards physical activity, and also how they were measuring levels of population physical activity in their adult populations. And then following these meetings, we did some extensive follow-up work to complete comprehensive audits and analyses of these 3 Ps. So I'll just start off with the policy audit first of all. So here we identified over 100 relevant policies, and we saw a fairly strong focus on that active environments domain of GAPA. And we saw this in a couple of ways. So first of all, planning and infrastructure was a key sector lead. And it was also a key policy domain where action was proposed along with transport and environment. And not surprisingly, most of the policies addressed physical activity in terms of it being a co-benefit of a different objective, such as enhancing livability. We also saw some encouraging signs of multi-sectoral engagement. So, for example, close to 1 in 2 policies were developed using 2 or more agencies. Responsibility for implementation of those actions that were relevant to physical activity was also commonly described as shared, such as between a lead and a partner agency. And physical activity was typically addressed by covering 2 or more different policy domains. But we did identify some areas for strengthening. First of all, greater attention towards high needs groups and what can be done in the healthcare and workplace settings. Perhaps some scope to employ a wider range of mechanisms, because the most common mechanism was typically described as informational in nature, such as the provision of education or guidance. And third of all, greater attention towards strengthening that active systems component of GAPA, because in most cases, funding wasn't clearly described and few policies had clear and specific indicators for monitoring. And in the very few instances where governance was mentioned, few of these were independent of government. Moving on to the programs audit, we identified over 70 programs relevant to physical activity. And in contrast to the policy audit, where we saw a lot of activity in the transport and the planning sectors, most of the programs were directed at the sport and recreation and the local government and communities settings. And similar to the policy audit, we found that there were far fewer programs in the healthcare and the workplace settings. And you can see some examples of the programs that we identified in the square boxes. The most common modality for delivering programs was through funding, basically to support the delivery of programs by others. Provision of information was also a common modality, and we included things like mass media campaigns in this category. And at the other end of the spectrum, you can see that environmental change and transportation interventions were the least commonly used. So I've gone through 2 out of the 3 Ps, policies and programs. I'm now going to touch on the last P, which is prevalence, and related to that, surveillance. So initially our work concentrated on the prevalence component. So essentially understanding how the different states and territories were measuring levels of population physical activity, at least in their adult populations. We subsequently broadened the scope of this to encompass the wider surveillance system, trying to see how jurisdictions were monitoring the various influences on physical activity beyond physical activity behaviours. What you can see here are the proportion of adults meeting physical activity guidelines as reported by each of the states and territories in their population health surveys. What you can see here is a great deal of variation and some fluctuations over time. You can also see that there are some numbers against some of the trend lines, and these indicate points in time where jurisdictions change their definitions or their questions for determining adults meeting guidelines. But the variation that we've seen and the fluctuations that we've seen are not reflected in this particular graph, which is a state of territory-based analysis of the National Health Survey. This lack of standardisation in the determination of prevalence rates between jurisdictions limits the comparability between jurisdictions and also over time, and how informative they can be for understanding the impact of that jurisdiction's policies and programs. A key question that we were interested in exploring is whether Australia is ready for a physical activity surveillance system. So one that is standardised as well as more comprehensive, encompassing the measurement not just of physical activity behaviours, but also broader influences in the system. So to explore this further, we held workshops with policymakers from each of the states and territories to gather some information about what they were monitoring in terms of these broader influences, basically to see whether there was a common set of indicators that could form the basis of a more comprehensive system. Following these workshops, we synthesised the information according to the sector that they related to, as well as the type of indicator that it was. So whether it was an individual indicator, a settings indicator, environmental or policy. And then as a third piece of work, we created a set of model indicators, looking at the indicators reported in the literature, as well as used in the Canadian surveillance system, as well as reflecting on the indicators shared in the workshops. And we put these forward to NPAN for their feedback on how important they thought each of these elements were as part of a comprehensive surveillance system. The findings from the workshop revealed that the most widely available indicators were individual in nature. So they related to physical activity behaviours such as active travel to school and to work, as well as participation in sport and recreation. Less widely monitored were all of those types of indicators identified in grey. So things like indicators around social norms, what's happening in key settings such as healthcare and workplaces, environmental indicators such as distance to public transport and to bike paths, and policy indicators such as the implementation of education mandates for a minimum amount of PE in schools. This was a set of model indicators that we put forward to NPAN for their feedback. They cover the 8 domains for action, as well as a set of indicators around infrastructure support, or all of those systems enablers that we saw in the conceptual map, so things like leadership and governance. And we asked NPAN to rate the importance of all of these indicators as core elements of a physical activity surveillance system. The feedback that we received from them was that the most highly rated indicators were mainly individual. Less highly rated were indicators relating to settings and environments, as well as policy and interpersonal indicators. In terms of model indicators for infrastructure support, we see that the most highly rated indicators were around leadership and coordination, monitoring and intelligence, as well as funding and resources, although quite a number of them were also moderately rated as being of importance. We have some suggestions for what is needed to advance ASAPa in Australia. So first of all, further national discussions and cross-agency leadership and collaboration. Second of all, jurisdictions need to share more detail about their existing measures and their data systems to identify which of the indicators have the greatest potential for alignment and integration as part of a more comprehensive system. Third of all, it's important to address the standardisation issues identified in population health surveys for the measurement of physical activity. And this includes having attaining agreement on consistent age ranges to use, as well as definitions and questions for determining the satisfaction of different components within the national guidelines. So things like aerobic physical activity, as well as balance and strength and sedentary behaviour. And finally, it's important to note that these comprehensive physical activity surveillance systems can be built in stages. So starting with a set of core indicators that are most important, and then expanding out to encompass a wider variety of indicators as and when resources and capacities allow. And this has been the case in Canada, which is one of the few systems in the world that is so comprehensive and has been in place for a long number of years since 1997. I'm now going to move on to Getting Australia Active 3, and what this relates to is the knowledge development and mobilisation component of the systems map. as the name suggests, is not the first of its kind in Australia, but one of a series of evidence reviews led by Adrian Bauman and Bill Bellew over the last 25 years. What's particularly different about this version is its explicit focus on systems approaches. So in Chapter 2, we explain in detail what we mean by this. We also set out evidence-based recommendations across the 8 domains for action. And since high needs groups received limited attention under existing policies and programs, we have a separate chapter on addressing equity. And finally, we've outlined some considerations for a physical activity surveillance system, which I've touched on already. So this resource is freely available for download from the Prevention Centre website, and it comes with a number of summary briefs, which you might also find useful. I'm now going to discuss another systems enabler, which is the role of laws and regulation for physical activity. So our work here was at a broad conceptual level, exploring the many possibilities for using law in relation to this issue, as well as having a focus on the built environment, so understanding the laws that affect physical activity, particularly walking and cycling in the built environment. Okay. Now you might be wondering what law has to do with physical activity. So I'm just going to play this short video as an introduction to this. All right. So this is the framework that was mentioned in the videos. It's called Ramparts, and I'll just walk you through some of the key components of this framework. So at the centre, we have lawmaking, and that refers to things like understanding how physical activity promoting laws get passed in the first place. Surrounding this, we have 7 different legal mechanisms or how law can operate to affect change. They include things like requiring something or setting standards, authorising or establishing a mandate for something, prohibiting or discouraging. In the outer 4 boxes, we've identified the 4 gapper areas where legal interventions can be directed at. And in the outer light blue circle, we've identified key mediators for action, because the effect of laws on physical activity doesn't just depend on what they say and what they cover, but also how well complied with, implemented and enforced. So this conceptual framework can be used by researchers to help generate research questions, and for policymakers to prompt consideration about the broad areas in which laws and regulations can possibly make a difference towards physical activity. So when we presented this framework to our policy partners at NPAN and we explored the potential for future work in this area, we learned that a key area of interest was in understanding the legal barriers and enablers that affect walking and cycling, particularly in the built environment. So I'm just going to play this another short video just to introduce this next piece of our work. Okay, well, I'll just note that our results aren't quite available yet on the Prevention Centre website because we currently have a manuscript that's under peer review. But I am in this presentation going to go over some top-level findings. So as the video mentioned, there were 3 main things that we looked at. First of all, the coverage and specificity of laws that impact the built environment for walking and cycling, how they aligned to evidence-based recommendations where those were available. And we also were interested in seeing what legal support there was for implementation and monitoring. So in terms of high-level support for physical activity, what we were looking at here was whether there were objectives in primary legislation that aligned with physical activity promotion. So by primary legislation, I mean things like the Planning Act, Transport Act, as well as any Climate Change Act. And we're looking to see whether they had objectives such as for health, as well as to promote active or public transport and livability, things like that. As you can see here from the results, few jurisdictions actually had such objectives. To give an example of where this was achieved, I'll just cite a few examples. So in South Australia and Queensland, their Planning Act has as an overarching objective, an objective to achieve ecological sustainability. And as a guiding principle for achieving this, the creation of healthy communities. As a separate example, in Victoria, they have a piece of transport legislation called the Transport Integration Act. And that has as an objective to promote forms of transport that have the least impact on the environment and the greatest benefit for and the least negative impact on human health and well-being. So that's just a couple of examples. We were also interested in seeing to what extent jurisdictions had measurable standards for built environment characteristics that are known to be associated with promoting physical activity. So by measurable, I mean objective, so as distinct from something that is descriptive or purely aspirational and qualitative in nature. So as an example of an objective standard, this might be a requirement for new office buildings to set aside at least 20 bike parking spaces per 100 employees, as opposed to a more qualitative standard that merely encourages the provision of end-of-trip facilities. So we found that only 4 jurisdictions addressed more than half of the 12 standards that we looked at. And the most widely addressed standards you can see are the ones on the left, the least commonly addressed, the ones on the right. Where jurisdictions did have objective standards, we looked to see how well they aligned with evidence-based recommendations, where those existed. And we found that few jurisdictions had standards that fully aligned with recommendations, and no jurisdictions had standards that fully met the recommendations for the 4 things that you can see in the brown box. So minimum residential density targets, as well as access to public open space, primary schools, and public transport. To give you an idea of why a jurisdiction might not fully meet recommendations, I'll just give you another example. So one of the recommendations is for at least 80% of dwellings to be located within 800 metres of an activity centre. A jurisdiction might not fully meet that recommendation if instead of specifying a percentage, it would simply say a majority of dwellings, or it would specify a further distance such as a kilometre instead of 800 metres. We also looked at what legal support there was for implementation and monitoring, and we considered a few things here. So first of all, whether the jurisdiction had a single source of default and comprehensive provisions for design and planning that applied jurisdiction-wide, because we felt that this would promote consistency of outcomes across the jurisdiction. And we found that most states and territories do have such a single set of provisions. We also considered design review because we thought this is a beneficial process for improving the quality of design outcomes on the ground. Basically, design review generally allows the setup of independent panels of experts who can advise on development applications before they are assessed. We found that 5 jurisdictions actually had provisions allowing for the establishment of such panels, but only 2 specified circumstances where it was mandatory to go through this process, which potentially detracts from the value of this process. And finally, we looked to see whether jurisdictions addressed performance monitoring in their planning law. And we found that few jurisdictions had legal obligations in their Planning Act for performance monitoring. An example of where this was achieved was in South Australia, which allows the planning minister to set performance targets for the planning system, which must be monitored by the Planning Commission. So what are the opportunities for improvement? First of all, amending primary legislation, so your Planning Act, Transport Act, any Climate Change Act, to enable a more integrated approach to creating environments for active living. In this way, creating a more authorising environment for the different agencies to be working together towards this common agenda. Secondly, where they do not currently exist, incorporating evidence-based standards into planning law. So this could mean taking them out of non-binding policy documents and including them into legislative documents or legal documents. It could also mean creating objective standards where only qualitative criteria exist. Third of all, realigning existing legal standards so that they do meet recommendations where they don't currently. And fourth of all, strengthening obligations to monitor the performance of planning law in order to ensure that the planning system is operating to achieve objectives that are consistent with active living. So I'm just going to recap the journey so far and what's next. And here is the bird's eye view that I presented earlier. So we started off in the bottom left-hand corner with policies and programs mapping, seeing what sectors were active in this space of physical activity promotion. We looked at prevalence, seeing how jurisdictions were measuring population levels of physical activity. And we also considered the broader surveillance system as well as part of this. We sought to support knowledge development and mobilisation with our evidence-based guide, Getting Australia Active 3. And then we finally explored the role of laws and regulation for physical activity with a particular focus on the built environment for walking and cycling. So I'm pleased to say that while our project has come to an end under our existing funding, we do have the opportunity to expand our work under the wonderful leadership of our colleague, Associate Professor Melody Ding. So I'm just going to pass over to Melody, who will explain this exciting phase that's up ahead, which will be known as ASAPa+.
Hello, everyone, and greeting from Germany, where I am at the moment. And it's just really, really fabulous to see the amazing work that has happened in ASAPa, and congratulations to the team. And for the next step, now we know that we have mapped out the physical activity landscape in Australia. We understand conceptually the important players that should be involved in the process of getting Australians more active. And we understand that there are so many different channels and domains where we could target our interventions. What we thought is, how about we move on to the next step by providing more quantitative tools to the policymakers so that we could present and quantitative answers to a question. A question could be, what will be the return on investment if we build this bike path, for example, in this particular area, or if we move the population to be, 5% more active. So getting all these conceptual system stuff into a quantitative tool. So this is a co-design process, and this is a funded project for the next 5 years. And we're really excited that, we could now move on to the plus stage of ASAPa. And because this is a co-design process, and because you are here, both policymakers and researchers who we hope to mobilize and co-design the tools together, we do have a few questions for you in terms of what kind of information are you seeking for in terms of, trying to make an argument for a specific project, an investment, or trying to choose between different kinds of investment options for physical activity. So I'm just going to have the 2 more Slido polls. I promise you it's the last 2 ones, and that will really start to help us conceptualize what the tool will look like. And also, if you have any burning questions or any comments, feel free to reach out to us, because we want to make sure that this tool is designed for you and with you. So could Karen put the last 2 Slido poll questions up? So I'm just going to explain a little bit how this decision support tool will work. We could potentially model a specific target for advocating for investment. You know, for example, we're going to make people this % more active, or this segment of the population this % more active. What do we get in return? Or it could be more intervention specific. For example, we could design a tool to help you decide whether we're going to invest more into, for example, a bike path, parks, and other areas. So to choose the right strategies. Or it could be a tool that is designed to both help us quantify the targets and return on investment when it comes to interventions. So I know it's quite a lot of information here. I'm just going to leave some time for you to have a bit think through, and feel free to ask any question through Q&A. Thank you. And we're going to move on to the next question. So one of the really unique aspects of this decision support tool that we're hoping to design, and that's going to be, you know, hopefully the first in the world by the time it's launched, is that we understand it's really important we need to work across sectors, but different sectors might have different KPI and different outcomes they're interested. And we know that physical activity interventions could be cross-sectorial, and we could have potential co-benefits, as Tracy has mentioned. So what kind of co-benefits are you the most interested in? It could be, you know, environmental when it comes to reducing congestion, improving air quality, and reducing carbon emission. It could be economic outcomes. It could be, you know, in terms of productivity and reduce healthcare costs, or it could be, you know, health outcomes in terms of preventing chronic disease and disability. So we like to see how you rank these different co-benefits. And if there's any other benefits that we have not mentioned here, please feel free to leave them in the chat or reach out to us. Like what I said, we're hoping to design this with you and for you. Thank you very much. And I think that the Slido poll could be happening in the background, and I'm going to return to Tracy for the final Q&A. Is that right?
It's over to me, Melody. So we've got a little bit of time now, fortunately, following the presentations, for there to be some comments, questions. You've had a pretty extensive amount of work presented this afternoon that commenced with the early efforts to develop an understanding of the system that influences physical activity. We talked about the auditing of policies and programs in Australia, examination of the physical activity surveillance system, exploration of laws and regulations, and Melody's talked about the future directions in relation to developing some tools to quantify kinds of knowledge that can inform our policies and programs into the future. So there's a lot there. We're open to people unmuting, and just put your hand up and indicate that you'd like to make a comment, ask a question. Adrian, Bill, and Tracy are on video and can comment and respond to the questions that you raise. What I might do is just commence with a question to the team. An enormous and I think fair to say groundbreaking exploration of the various dimensions of the system that influence physical activity in Australia. Based on that work, could you identify where you think there are some clear and neglected opportunities to intervene to tackle physical inactivity in Australia? Adrian, you look like you're ready to respond.
One quick response, and it's partly also in response to the question. We've been looking for a national physical activity strategy for over a decade in Australia and hoping that it happens, and maybe it will one day. We're one of the few high-income countries without any national physical activity strategy or plan. And I know it's difficult with our 7 jurisdictions, but we need national leadership in this area. However, the work that ASAPa has done can inform that. We've actually passed this on to the policymakers and people that we work with. And we hope that that will stimulate discussions, national fora, in which we'd be happy to help facilitate discussion or contribute to discussion to further this process. Because we can't make systems happen. We can only identify them. We hope that the policymakers, the systems, the government, the NGOs, get engaged now and start to work in this space together using a whole bunch of stuff, models and frameworks that we've developed in the last 3 years with this delightful to work with team. I forgot to say that at the beginning.
Thank you, Adrian. Bill.
Thanks for the question, Ben. I agree exactly with Adrian's comments, but PALS, the physical activity surveillance system, as opposed to not a fail, is an absolute standout one for me. If we were, first of all, to get the same measures in jurisdictions, or at least some comparability, that could tell us a whole lot. It's all very well to have a national survey once every few years, fine. But if we really had the power of aligned state-level surveys, that could really be a great source of evidence generation. And it would also allow us to say, well, look, these voucher systems seem to have done something in New South Wales. What actually went on there? Of course, there's other cohorts at play in New South Wales as well. But opportunity knocks if you align your surveillance questions, or even if you just have a few that we agree on for consensus. That would be my low-hanging fruit that we haven't been able to take advantage of.
Thank you. And there's some comments coming through in the Q&A that we have, the potential to move forward to a national physical activity strategy is, as you suggested, Adrian, or the question was there, is it too soon? But I think we're hearing that you don't think it's too soon. You perhaps might say it's overdue. Yes, we're getting a nod on that one. Feel free to add any questions, comments you've got in the Q&A, or raise your hand and speak up. A further question that I'll bring to this panel concerns how the kinds of systems analysis that you've done can be used at more of a local or regional level, and what the possibilities are there. Bill, you look like you've unmuted.
I was thinking about Western Sydney a moment ago, and we know that we have Western Sydney active participating in this webinar. If you think about the map that we showed at the very beginning, it's a bit of a template really rather than the map. I mean, it is an Australia-wide map. It's generated by evidence. So if you want to do a mapping, let's say for Western Sydney, one idea is that you don't have to start absolutely from scratch, or if you're doing it in another region, you could take the map that we've used, disregard the bits that don't seem relevant, add your own bit, do your own work there, and for a local area, for Western Sydney, what it helps you do is helps you understand what might be going on in your area. In a sense, you're building your own theory for your own region or your own place. Important to say that the map is not the territory. People who inhabit that territory, the local workers, the people from the different sectors, they know it better than any one individual. So it's a team sport. So by bringing people together in an intersectoral sense, we can build a better map, we can better understand things. When we have that map, then what we can do is we can understand the situation better. We can find places where there might be opportunities to harness action. Perhaps we can see where we've overlapped. And more importantly, we might be able to see a really important area where we've all forgotten to take action. Gosh, there's a law there that we could enact, enforce, monitor, and we've all forgotten to do it. So that's a few examples of how you can use that. The important thing is to have a bias for action. So it's not really about generating a new form of artwork. It's about taking action.
Yeah, good comment. Thanks, Bill. Adrian.
A question from Sarah that's just come through on what one priority should we focus on, and that is having a surveillance system, because a range of data beyond individual level data can help inform and drive policymakers, to have community consultations and stakeholder engagement now to actually consider what might be possible. But the one thing that will drive action is having a plan. We need a national physical activity plan. And without a plan, we haven't got the imprimatur, the cross-agency collaboration to actually make this go forward. So the one thing that we need is a national plan, and in the absence of that, very good, clear state plans with accountabilities, performance indicators, and targets over a 5 to 10 year period.
So I think a very clear call from you there to all of us who are concerned with physical inactivity to take whatever opportunities that we can, the levels at which we work, to advocate for the development of those plans at the state level and ideally at the national level.
It can even be at a municipality level. Where I am in Denmark, most things actually happen at the municipality level. It could also be at a community that's otherwise geographically defined or culturally defined, but to take a large population approach or a large group approach and plan for what you're going to do and build systems into that will be the leverage points that start the systems thinking working at higher levels within the system.
Question that's come through from Randall is, do you see a role for mandated physical literacy approaches in schools?
I think, physical literacy is a really important concept. It gives us a vocabulary of different types of movements. It's not an absolutely brand new idea, but there's the sense that here's this broad vocabulary of movement, and it feeds everything from basic physical activity through to elite performance. So it's a broad framework that everybody can understand and accept. It's the word mandating that will cause some problems. And I think education is a sector that's got its own experts, its own policies and approaches. I think the way to get there is probably by encouraging the pedagogical systems within our training institutions that prepare our teachers to bed this down, so that it becomes, you don't have to mandate, it's more, it's how we do business. So I certainly encourage this as a good practice, a good conceptual usage. It's mandating is important when you really want to get something done, but it can also cause a lot of resistance. And one of the problems about education setting or others is that we might just see that setting in terms of physical activity. Well, guess what? Teachers think that education is a lot of other things as well, like producing, fully autonomous and informed human beings who are able to conduct themselves well in the future and not just be physically active or sports stars. So tread warily would be my advice.
Thank you, Bill. Look, we've run to time now. I might just give Adrian an opportunity to say any final words, express any words of thanks, and then we'll close the webinar.
Thanks, Ben. After several decades in the physical activity space, this systems work has been the most enjoyable with the team that you've had present to you today. I've thoroughly enjoyed the ride, but I think one of the most important things I've done. So I commend that the work now goes forward in the hands of all the people in the audience, and I hope that it can contribute to making a difference. And I'd like to thank the Prevention Centre, thank the team for the last 3 years of fascinating, sometimes challenging work in very new spaces. And with that, I think we'll close the seminar, and thank you all for your attendance.